Following the death of Andrew Holland at the San Luis Obispo County Jail this past January, several questions were raised on how mentally ill inmates are treated at the jail.
KSBY News reporter Brooke Martell joins us in the studio with more about the movement to keep the mentally ill out of the jail system. Brooke?
Well, Dan, it's been nearly 1 year since Andrew Holland died at SLO County Jail after being tied to a restraint chair for nearly 2 days. Today, we look at how policies have changed at the jail and how county mental health since his death and what's being done to ensure something like this never happens again. Documents I obtained through a public records request show that in the last 3 years, 3 inmates at San Luis Obispo County Jail were placed in a restraint chair. Of those 3, 36-year-old Andrew Holland, who suffered from schizophrenia, was in there the longest, for 46 hours. The county coroner at the time determined Holland's manner of death was natural and that he died from an intrapulmonary embolism. But a coroner hired by Holland's family says Holland died from deep vein thrombosis, linked to being immobile for so long.
When you have a son who has been killed, you begin to ask for more.
This disease does not discriminate. Over the course of nearly 2 decades, Holland lost friends, he spent time in and out of jail, and mental health services.
It's not a behavioral issue. It's a brain disease, not unlike a disease like diabetes.
Nearly 10 months after their son's death, Sharon and Cardi Holland are still adjusting to their new normal, but advocating for change.
We'll be able to help those that find themselves in the same situation that we found ourselves in.
Using the money from a $5 million settlement from the county, they're creating the Andrew Holland Foundation.
If we could have a situation where they were identified and separated and taken to treatment instead of incarceration.
Simultaneously, the county is working on a separate endeavor.
The Stepping Up initiative is also more about preventing and reducing the number of mentally ill people who make it into jail.
This is really focused at trying to keep people out of jail and then providing proper treatment while they're here to keep them out.
The county jail is not designed to treat people with mental illness. Still, the sheriff's office estimates about 40% of inmates have a psychological disorder. That's roughly 250 men at any time. Sheriff Ian Parkinson wants to expand the facility to create a mental health unit that could potentially hold up to 48 inmates.
The idea is to kind of remove that jail environment, turn it into a treatment environment, and we have the facility for that. It's going to take some remodeling, which will be underway very soon, because this is obviously a problem that can't wait.
Holland was in jail several months before his death. He had been in custody since September of 2015, charged with resisting arrest with force, battery on a police officer, battery, and a probation violation. Reports show the weekend of January 21st, Holland was put in the restraint chair because he was punching himself. But the jail wasn't the only facility within the county that could have taken him. Public records I obtained from county mental health show the Psychiatric Health Facility was full, but there's not much room there anyway. There are only 16 beds to treat patients coming from hospitals and the jail. I asked county mental health specific questions about the weekend of Holland's death, including if the facility was aware that Holland was in a restraint chair at the jail.
Many people had different pieces of information, and we didn't all collectively have the same information. And that's where some communication broke down.
Ann Robbins, SLO County's behavioral health administrator, says the process to get inmates into the facility has been expedited.
Since then, we have sped up, and anybody who is declared incompetent to stand trial, who has a misdemeanor, we take them within generally 24 hours.
Do you think that with all of these changes being implemented, do you think this could have saved Andrew Holland's life?
Sure. I mean, I think that's the purpose of the changes. You never want to have to make changes based on something tragic that happens.
Holland's parents support the county's proposed changes, even though they'll come too late for their son.
Actually, he'd be home now.
He'd be home now.
But since he can't be, his family will continue to advocate for those who have a chance at coming home.
We're not the only ones that have suffered, and we know that, but we don't want this to be lost either.
The Stepping Up initiative was approved by the board in October at the County Board of Supervisors meeting on December 5th. Sheriff Parkinson says he plans to present a full plan for Stepping Up, as well as prelim costs for mental health staffing and remodel of the new proposed facility.